Let me ask you a question. If your blood pressure was dangerously high right now, would you feel it? Would you even know? For millions of older adults, the answer is no. No symptoms, no warning signs, just silent damage building over years until one day it's a stroke, heart failure, or worse. High blood pressure is one of the most common health problems we face as we age, and also one of the most misunderstood. You may have it, you may be treating it, but do you actually understand what it's doing to your body and what you can do about it starting today? I'm Dr. Sam, and in today's episode of Senior Health Thrive, we're going deep into the truth about blood pressure, the good, the bad, and what no one is telling you at those 15-minute doctor visits. This might just be the most important health conversation you've had all year. Let's get started. If you or a loved one are over the age of 60, there's a very good chance this topic affects you directly. In fact, over 70% of older adults live with high blood pressure. Yet despite how common it is, many people don't fully understand what it is, how it works, why it matters, and most importantly, what you can do about it. In this video, we're going to go deeper than just the basics. We're going to explore what blood pressure really is and how it changes as we age. What's considered normal versus high blood pressure? Why high blood pressure is dangerous even if you feel fine? What causes it in older adults, how to measure it accurately at home and in the clinic? What the current treatment guidelines recommend, and why they differ between the US and Europe? How to make a practical plan with your doctor, and what you should do starting today if you're concerned. This isn't just medical theory. This is about helping you thrive, feeling stronger, living longer, and staying independent. So let's begin. What is blood pressure? Blood pressure is the force of your blood pushing against the walls of your arteries. That's it. But that simple-sounding pressure tells us a lot about your health. Your heart acts like a pump. Each time it beats, it pushes blood out through a large artery called the aorta. That blood then travels through smaller arteries to deliver oxygen and nutrients throughout your body. When the heart squeezes, that's called systole. When it relaxes between beats, that's diastole. That's why your blood pressure is written as two numbers. For example, 120/80. The top number, systolic, shows the pressure during a heartbeat. The bottom number, diastolic, shows the pressure when the heart rests. Think of it like water running through a garden hose. If the hose is narrow or stiff, the pressure rises. If the pump your heart pushes harder, the pressure also rises. As we age, our arteries naturally get stiffer, and that raises the pressure. What's normal? What's high? So what's considered a normal blood pressure? In general, a normal or optimal reading is less than 120/80. Once your systolic is between 130 and 139, or your diastolic is 80, 110, 40, 90, or higher, is stage 2 hypertension. Now here's where things get tricky. Not every expert agrees. In the United States, these guidelines were updated in 2017, but in Europe they still define high blood pressure as starting at 140 systolic. Why the difference? It's not because the physiology is different, it's because medical experts weigh risks and benefits differently. But either way, the higher your blood pressure stays over time, the greater your risk of strokes, heart failure, kidney disease, and even dementia. Why it matters? Even if you feel fine, one of the biggest challenges with hypertension is that it often causes no symptoms. That's why it's called the silent killer. You could be walking around with a systolic pressure of 160 or even 180 and feel perfectly fine, but inside your arteries are under constant strain. Over time, this damages the heart, the kidneys, the brain. It increases your risk for strokes, both the clotting kind and the bleeding kind. Now, if the pressure gets extremely high, above 180 systolic or 120 diastolic, then symptoms like headaches, chest pain, shortness of breath, or vision changes can happen. That's a medical emergency. But most of the time, the damage is slow and silent. What causes high blood pressure in older adults? For most people, high blood pressure has no single cause. We call this primary or essential hypertension. It's usually the result of several factors working together over time. Here are the most common ones. Age. Arteries stiffen naturally as we grow older. Obesity. Extra weight puts more strain on the heart and arteries. Genetics, family history plays a role. High sodium intake, especially in processed foods. Lack of physical activity. Alcohol. Heavy drinking raises blood pressure. Chronic stress and poor sleep. Yes, your emotional and sleep health matter too. Air and noise pollution. Sometimes, high blood pressure is caused by something else. This is called secondary hypertension. It might come from medications like NSAIDs, ibuprofen, decongestants, steroids or stimulants. Or it could stem from kidney disease, sleep apnea or hormonal issues. That's why it's important to get evaluated thoroughly, especially if your blood pressure is suddenly high or very difficult to control. How to measure blood pressure accurately? Let's talk about something most people and even some clinics get wrong: how to measure blood pressure properly. Here are the key steps. Sit quietly in a chair for 5 minutes before taking the reading. Avoid caffeine, exercise or smoking for 30 minutes beforehand. Use the right size cuff, especially if your arm is small or large. Support your arm at heart level. Don't talk during the reading. Take 2 or 3 readings 1 minute apart and average them. And if possible, measure in both arms the first time. Use the higher reading going forward. Most importantly, measure your blood pressure at home. A home blood pressure monitor with an upper arm cuff gives us a more accurate picture of your usual pressure than a rushed doctor's visit does. Why treatment matters and when to start. So when should we treat high blood pressure? For most older adults, we definitely want to treat if the systolic pressure is above 150. That's where the health risks really start to rise sharply. Now, newer guidelines suggest treating down to 130, but that depends. It depends on your age, your other health conditions, how you feel on treatment, and your personal goals. There was a large study called SPRINT that showed treating to below 120 systolic could reduce strokes and heart problems in adults over 50. But it excluded people with dementia, diabetes, or frailty. So as your doctor, I'd say, we don't treat numbers. We treat people. Start by lowering the pressure safely to under 150 and then talk to your doctor about whether to go lower. What's your blood pressure goal? Your goal may not be the same as someone else's. If you're 65 and healthy, maybe 120 is a great target. But if you're 88, frail and prone to dizziness, a target of 140 might be more appropriate. In Europe, for example, people 65 to 79 are advised to first aim for under 140, then under 130 if tolerated. People over 80 are generally treated to a systolic of 140. So speak to your doctor, ask, what should my goal be, and why? That's an empowering question. What you can do today. If you're concerned about your blood pressure, here's what you can do right now. Buy a home monitor with an upper arm cuff. Measure your pressure every day for a week at the same time. Write down the numbers and your pulse. Compare your results with your doctor's readings. If they're consistently high, you might have high blood pressure. Review your medications. Are any of them raising your blood pressure? Ask your provider what your treatment goal should be. Start lifestyle changes. Reduce salt. Stay active. Manage stress. Limit alcohol. And improve your sleep. And remember, blood pressure can often be improved within weeks, so the effort you make today could prevent a heart attack or stroke next year. As we age, our health becomes both more delicate and more important. High blood pressure is not something to fear, but it is something to respect and address, because you can live well with it, you can manage it, and in many cases you can reverse some of it. You deserve to thrive, not just survive in your later years, so stay informed, stay empowered, and stay connected here on Senior Health Thrive. I'm Dr. Sam, and I'll see you in the next episode, where we'll go deeper into the best ways to lower high blood pressure safely and effectively, including medications, diet, and more. Until then, take care of your heart, your brain, and your future.